Did you know that when your blood pressure is high, you are 4 times more likely to die from a stroke and 3 times more likely to die from heart disease? This is why talking about high blood pressure as a controllable risk factor for heart disease is so important. You just spent a few minutes watching the video about high blood pressure. We talked about how uncontrolled high blood pressure can result in hardening and thickening of your arteries. And I want to spend a little bit of time talking to you about what those blood pressure numbers mean. So, when you go to the doctor and they check your blood pressure, they're going to give you two numbers. A normal blood pressure is going to be a number of less than 120 over less than 80. So, they might say, oh, your blood pressure is 120 over 80. That's normal. Being below those numbers can also be normal. If your blood pressure is lower than those numbers and you are passing out as a result of that, then that is not normal. But otherwise, if you were to go get your blood pressure checked right now and your numbers were below 120 over 80, that would be totally fine. That's good. You want to hear that. So around 120 over 80, good, normal. The next stage is what they call elevated, the elevated category. And that's going to be a top number of anywhere from 120 to 129 and a bottom number of less than 80. High blood pressure. So this is where you are now in stage 1 of hypertension or high blood pressure. And these numbers have actually changed. It used to be just 3 levels: normal, borderline, and high. And now we see some extra stages here. So high blood pressure stage 1, the numbers are going to be anywhere from 130 to 139 over 80 to 89. Stage 2, 140 or higher over 90 or higher. And then stage 3 is higher than 180 and or higher than 120 on the bottom number. So very important to know these numbers. In that video that you just saw, they talked about high blood pressure being a silent killer because you don't know that you have it. So very important to be checking that regularly and know what those numbers mean so that you know what you need to do to control that blood pressure. Another controllable risk factor has to do with cholesterol, and high levels of cholesterol in your blood can increase the formation of plaque. We've talked about plaque already. Plaque are those fatty deposits in your arteries and can also increase the risk of atherosclerosis. So that's when those plaques or those fat deposits get stuck to the artery walls, and then they cause trouble with blood being able to flow through those vessels. I'm going to ask you to watch a video. So I have this, I'll stop this recording, but then I have a video to follow that will talk a little bit more detail about high blood cholesterol. So I want you to add any additional notes that you need to your risk factor note sheet. And then after this video, I'll go into a little bit more detail about the difference between good cholesterol and bad cholesterol.